For half a century, Family Health La Clinica has filled the gaps in medical services available in central Wisconsin, offering high-quality, affordable care. But it began as just a small group of activists and volunteers who came together to bring medical access to the most underserved people in the area.
Family Health La Clinica began in the 60s and then was formally organized in 1973 specifically to address the needs of migrant and seasonal agricultural workers in the state of Wisconsin.
Through the 1950s, tens of thousands of Texas Mexicans came to Wisconsin to do work in every single industry that you can imagine that had to do with food preparation.
I think I was about 11 years old when we started coming here. And we were work out in the fields. We would do cucumbers, we would do peppers, we would do lettuce.
At the height of this migration, 15,000 Texas Mexicans came to Wisconsin every single spring. The conditions under which Texas Mexicans lived and worked across Wisconsin could be considered basically deplorable. They had limited access to sanitation, limited access to reasonable housing. On top of all of that, of course, they had limited access to health care.
My younger brother Frank, he fell off the truck. He slipped when he stepped from the top of the asparagus crates. Since we had no insurance, you know, the whole season, the whole harvest of that particular crop was gone because we had to pay the doctor bills.
It wasn't until the 1960s when communities began to actually band together and seek to address radically and reform the conditions under which migrant workers lived and worked. Part of their efforts was to offer actual health care to workers. And one of the most important examples of that, of course, is La Clinica.
We started as a seasonal health center, specifically serving the thousands of workers that were coming into the state, in particular the heart of the state. Began very grassroots, like pretty much all community health centers began.
In '68, we opened the clinic, but initially it was all volunteer. Nobody got paid for doing this. People did it on their own time.
We only had 2 dental chairs, and we had no physicians or doctors, so we sought out volunteers in the area.
They had a lot of people on the board of directors that were actual former migrants. They knew how to connect with the population. So it started off with a very small core where they planted a little seed, then it started expanding.
La Clinica was founded in the late 1960s, early 1970s to offer healthcare access within the camps, right? So if we can't get workers to come into cities, into towns to access healthcare, how can we take healthcare out to them?
We became formally recognized as a nonprofit in 1973 as La Clinica de los Campesinos, doing business now as Family Health La Clinica.
In 1977, La Clinica opened a permanent facility in Wild Rose to better serve migrant and seasonal agricultural workers with a dedicated staff.
We would go to La Clinica, and they treated us really nice. Really, really, really nice. You know, even though we were migrants, you know, we grew up going there.
As La Clinica grew its resources and infrastructure, it received attention from health researchers who confirmed its impact on the health of migrant and seasonal farm workers. Organization leaders looked for ways to share their services with all residents of central Wisconsin. In the 1980s, La Clinica received federal funding to become a community health center, a legal designation which allowed it to offer wide-reaching health services in the area.
One of the things that La Clinica has done is going through a transformation where they originally started serving only migrant seasonal farm workers. And they were doing such a good job that the general population, the general public was saying, yeah, we benefit from those good services that you provide.
People saw what work that La Clinica was doing, and they said, we need that in our community. Are you interested?
So we went from seasonal and only serving migrant and seasonal ag workers to serving anyone. We are here not to duplicate services, not to compete with other entities that are providing services, but to fill gaps and to address unmet healthcare access needs. The board makeup has to be made up of 51% or more of people who use our services. So people who often don't have governing voices are the ones that are making the governance decisions within a community health center.
La Clinica, I think, takes a look at family health. They take a look at what we need, and they meet those needs.
We've assessed that there are needs for primary medical care, in particular for people who are uninsured, underinsured.
We take all patients of all insurances, ranging from Medicaid to Medicare to Badger Care to commercial insurances.
20% of our patients still have no insurance. We see anybody who needs to be seen. We will never deny any care to anybody, doesn't matter what.
There is even greater need for services like dental.
Family Health La Clinica worked to meet the dental needs of the area by establishing 4 clinics, creating widely available, affordable, high-quality care which otherwise would not be available in the area.
I had a foster son who needed dental work, and I was driving 2 hours to take him to the dentist. That's 4 hours in a car a day to get services.
Many dentists do not accept Wisconsin's Medicaid program, Badger Care. So those dentists that maybe even are serving in a rural environment are not accessible to people who use Medicaid.
So paying out of pocket for low-income people is usually not an option. So we do have a sliding fee program where we are able to get those patients in and get them cared for at a relatively nominal fee.
It's been a blessing for our family because it was difficult for us to find insurance. They've been able to provide care that we've needed for our kiddos, and we've been really grateful for it.
And behavioral health services are just definite unmet needs. And so we have, in the past several years, really worked hard to build out those service lines to improve access.
Let's say a child is going through foster care and is pre-adoptive. Some treatment involves play therapy. It involves using expressive play interactions to get to the root cause of maybe what's distressing them.
I believe family health makes a big difference in the substance use recovery world because we don't take patients at what we see when they walk into our door. We want to make sure we treat them as another human being here because that's who they are.
And the host of other services now offered by La Clinica include treatments for recipients of the Women, Infants, and Children, or WIC program, massage therapy, and an in-house drive-through pharmacy. Family Health La Clinica offers this wide array of resources from its network of clinics. Its flagship clinic in Wautoma broke ground in 1996, and since then has continually expanded and adapted to maintain state-of-the-art services. Here, La Clinica provides all of its services in an integrative healthcare model.
Family Health La Clinica is really a hub of services, taking care of the patients from start to finish.
What's really unique about Family Health La Clinica is the fact that, we offer a variety of services, whether it's dental, medical, behavioral health, you name it, we got it kind of a thing. And to be able to walk your client down the hallway when they have a tooth that's bothering them and to have a professional take care of that right away, it's pretty unique in my eyes.
Since 2010, they have opened 4 additional clinics in other communities, each offering specialized services. Dental care in Mauston, medical and behavioral health services in Friendship, and medical, dental, and behavioral health services in Beaver Dam and Stevens Point.
They have expanded across the state of Wisconsin, providing services in a number of communities that they didn't when I first was on the board, which is great.
The thing that's really amazing about community health centers like Family Health La Clinica is the way that they are designed to be responsive to the unique needs of that community.
We like to tailor the experience and the preference of our providers to best meet the needs of our communities. One of the challenges to work with communities that may be marginalized is being able to build that trust with the Hmong community or the Amish or the migrant and seasonal agricultural workers. In Wautoma, I believe we've done a really great job of hiring on members from the communities that we serve to serve as our staff members.
Being a Spanish-speaking physician gives me the opportunity to be able to actually treat and understand my patients in a little different way. And I can tell them what needs to be done in their language, in their culture, what they need to do to be able to make themselves better.
And so as we set up our clinic in Stevens Point, Family Health La Clinica has made very intensious efforts to hire on staff that speak Hmong as their first language. I myself grew up in the Hmong community and speak Hmong, as well as continue to promote our interpretive services for our English-speaking staff.
As services and facilities continue to increase, so do La Clinica's patients, which have tripled in just 7 years.
Another thing I'm really proud about is, again, our board and organization's commitment to expanding access. So when I began, I think we served about 8,000 unique patients and 24,000 patient encounters. And last year, if you include all of our programming, it would be over 24,000 unique patients and over 70,000 encounters, which is just an incredible improvement in access.
During all of Family Health La Clinica's expansion, it has always stayed true to its original mission.
They still have not abandoned the migrant seasonal farm worker population because they are probably the most in need.
They serve Wisconsin's migrant and seasonal agricultural workers, or MSAW, primarily through a mobile health clinic which visits migrant housing on site at farms and factories.
Migrant and seasonal egg workers have a very difficult time accessing primary care because typically they're working when clinics are open. So that means our team is going out providing those medical services.
We coordinate with employers that hire farm workers to take the mobile unit out. And we go twice, 3 times, depending on location and need. And we provide primary care to the farm workers.
Pues ya va uno a un doctor particular y pues le dan un Tylenol a uno y ya le cobran a unos 700 pesos y aquí lo que gana uno pues es poquito, le pagan $12.50 por hora y imagina, paga uno $3,000 o $1,000, pues no, pues muy bonitas personas y se los agradezco que pues vienen a uno a verlo hasta acá uno, ¿verdad? Y pues una ayuda, ¿verdad?
We really provide, I think, a state-of-the-art visit for patients here.
We have a lab on the unit, so we're able to provide that real-time lab results.
Through our screening, we'll pick up many new diagnoses. Diabetes is probably the most frequent thing that we will diagnose here. We can get them started on appropriate treatment and reduce their chance for serious comorbidities like a heart attack or stroke.
We do serve patients in 20 counties here in the state of Wisconsin.
On Monday and Tuesday, we're way up north in Cumberland, Wisconsin. And now today we're way down south in Janesville, Wisconsin. So we covered a lot of miles this week.
I love working with the farm workers and being able to serve that population. I can go into a labor camp and be able to let them know, hey, I'm from Family Health La Clinica, I'm here to serve you. They would trust just because of our name.
We're able to build relationships with our patients. We're able to find out where do they live, how their family is doing, and we're able to be so close that we're on a first name basis.
Familiarity between patients and providers is also common at La Clinica's home base in Wautoma, where individuals and families have received continuity of service for decades.
There was a woman that I saw, a young woman in her early 20s. One morning I went into the room to see her and she looked very in distress, very tired. Her legs were all scratched up and very swollen. And she looked a lot older than her age, and I asked her, what happened? And she said, well, I just crossed the border 2 or 3 days ago. I examined her, talked about her injuries, and then you talk a little bit about the emotional part. Actually, she was quite young and basically healthy, so she did okay on her own. Over the years, she had moved into the area, and she got married, she had a family. Eventually, I was seeing her kids.
My parents have been coming to Family Health La Clinica since their doors have opened. The provider that we see, which my parents see, I see, my family, my sister is Dr. Javier Rincon.
I have 4-generation families and I take care of them, and it's very important for me because I know the inner circle of what's going on, because not everything is physically but also could be emotionally or mentally.
And I would see grandma, and then I would see mom or dad, and then I would see their kids. And it was kind of like the ideal of family practice.
50 years ago, Family Health La Clinica was created to bring medical access to those in central Wisconsin who needed it most. Their work has treated hundreds of thousands of people, many of whom could not have accessed comparable care anywhere else.
They've served us well. I can't say enough about what they have done to make this a better place.
Well, I'm just proud that we've reached the point that we have of 50 years, which is unbelievable.
It truly is an honor. The mission that the clinic has and the impact that we have is life-changing.
La Clinica's mission is not just to provide health care, but to find gaps in that care and fill them. That's why in the last 50 years, it has rapidly expanded from a small group of volunteers serving migrant workers to 6 clinics, giving care to all kinds of people throughout the state, providing affordable services including medical, dental, behavioral health, and beyond.
Our job is to move the needle on the health outcomes in the communities that we're in.
La Clinica, of course, has a half-century-long history of doing this type of work within the community, alongside the community. Today, many of those issues that La Clinica faced in the 1970s continue to, unfortunately, still be persistent. And they are best poised, I think, to really address those moving forward as well.
We're very aware that we stand on the shoulders of those that have come before us and try and provide that level of service and add new services as we move into the future.